Hi, everyone. I'm Hillary Frank, host of the podcast The Longest Shortest Time with WNYC. Welcome to our Google Hangout, Ask a Pelvic Floor Physical Therapist Anything. This is a part of our ongoing Sex and Parenthood series, which you can find at longestshortesttime.com. The last episode was about healing after a childbirth injury and how to get back in the sack after you are in pain down there. I mentioned on the show that there are a lot of different kinds of healthcare workers who help people with pelvic floor injuries, and the type of therapy that worked best for me was pelvic floor physical therapy, and I had never heard of it. It took me 3 years to find it. And I know that a lot of you have never heard of it before, so I thought I would bring my pelvic floor physical therapist, Debra Goldman, onto a Google Hangout to answer your questions. Hi, Debra.
Hi, Hillary. Thanks for having me.
Yeah, welcome. So I want to get to people's questions. First, I just want people to know who you are. You have been a physical therapist for 25 years and been doing pelvic floor physical therapy for 11 of those years. And you now have your own practice called Four Corners Physical Therapy. And so before we get into these questions, there's something you do when you first have patients come see you, right? And you have them fill out this form, and they write down their goals for how they want to get better. Right. And you sent me a bunch of them. And I'm going to read some of my favorites because I just want people to see this is like real world stuff that everyone's dealing with every day that we don't talk about, right? So I'm going to read these. I want to laugh hard at funny movies without peeing all over myself. I want to go back to my favorite restaurant without carrying around this donut pillow. I want my C-section scar to stop hurting so I can finally lie on my stomach. I want to stop leaking pee when I have an orgasm. A lot of leakage going on here. And the last one, I want to do downward dog without all the queefing.
That's a big one.
Yeah. So people come in, they tell you these goals, this is how they want to improve, and then what? Like, can you briefly walk us through how you work with patients?
Sure. Well, after they give me their whole subjective history, then I ask them their goals, because I want, even though I'm getting some of the technical information and the subjective history, but I always want to hear it in their own words, because I want to bring it back to them. I want to make it patient-centric. But, overall, I would say that physical therapists, we're experts in evaluating and treating musculoskeletal injuries and issues, and that we do that with exercise and manual therapy and neuromuscular retraining, which is learning how to move well. But pelvic floor physical therapists go beyond that, and we go below that, and we lean towards it, and we evaluate the internal pelvic floor muscles, as well as the pelvic nerves, the pelvic viscera, the connective tissue, and so it allows us to really look at what are the bladder and bowel and sexual dysfunctions that, for our purposes, so many postpartum women are experiencing. So I always start with a full musculoskeletal exam, because I want to look at how their spine and their hips are moving, how they're thinking about using their abdominal muscles, how their perception of their core is, and then I do a specific pelvic floor internal exam. So I'm looking at pelvic floor muscle tone, seeing if there is any trigger points, seeing what the perineum is like, checking their strength, seeing if there's any nerve irritation, and then we put it all together and create a treatment plan that's specific for that patient.
And so the internal exam is treated just like any other part of the body?
That's right, because I explain to them that I'm going to do a pelvic floor muscle exam, that it's not like when you go to your OBGYN and you put your legs in the stirrups and use a speculum, that it's that I'm going to be using my gloved hands, and I'm going to do it internally, and it might include both vaginal and rectal examination, and that I always assure them that it should not be painful, the exam itself. We might find areas that are painful and that those will be noted and that's what we're going to work on, but that the exam itself is very gentle, and I really want them to be part of it and be present, because I want them also to really get to know this part of their body, so that a lot of women feel shame because they don't know what's going on, and nobody is talking to them about it. So I really want to get them involved in their care, and I think that's what pelvic floor physical therapists do. We really approach these patients with the intent to cure or to help them maximally, and also to empower them. And I think that's a really different type of care. And I think so for someone who comes in with anxiety or fear about their pain or just about the evaluation itself, I think they leave feeling much better about the whole process, and they have hope, which is something that you can see from all the input that you're getting. So many women just feel like this is hopeless, recovering from childbirth.
Yeah, I mean, it doesn't get talked about, right? And this is stuff that a lot of people are walking around with. I've heard from doctors that a lot of women will, just decide to give up, because it's too hard to find help.
Well, I think it's hard to find help because, and I hear this from my own personal experience from listening to my patients, that when patients go back to the OBGYN, or if they decide then to go to a urologist because they're having a leaky bladder, they're really not offered a plan. They're still told to give things time and that it will just get better on its own, and whatever it is, and there's a lot of it out there. Or people are still being told, what do you expect? You just had a baby, so why wouldn't you be leaking? Or I had one patient who told me, she told her OBGYN she really wanted to go to pelvic floor therapy, and he told her, just walk around the mall. That's therapeutic enough. So those are really unsatisfactory answers. And, I think that finally women are able to take charge of their health. And the good thing is that physical therapy in the United States is mostly direct access. So now most women don't need to get permission or a referral from their doctor. We like to include the physicians in their treatment and in their plan, but they are free to come and get the care that they need and they deserve.
So you're going to show us some real concrete ways that physical therapy can work on the pelvic floor. So, I think it's surprising to think about all the ways that your pelvis interconnects with the rest of your body. So I asked you to bring along some props.
Okay.
To help us to see. So you have these things in front of you. Do you want to just sort of wave up there? You've got a model of the pelvis.
Model of the pelvis.
Yeah.
So this is the pelvic girdle. So
yeah.
That's the pelvic bones. It includes the sacrum and the coccyx. It includes the pubic symphysis. And most women are very surprised to think about the idea that this is where your hip joints are too. So it's very connected to your hip function. And then I have my spine, which, so it's a full spine, although the pelvis is no longer on this, but it has the sacrum in the front and the tailbone. And then because I always like to explain how the spine interacts with the pelvis and why it's so important that I'm looking at their spine motion and the hip motion.
Show us how the spine interacts with the pelvis.
Well, the spine, I'll use this model first. So the spine, the bottom of the lumbar spine, which is referred to as L5, it's a very important joint with the top of the sacrum, which is called L1. So L5S1 is very important, and my L5 is actually missing on this side, but you can see it here. So the reason it's so important is because the spine, you're loading your weight through your spine into your pelvis. So the pelvis absorbs the loading that comes from gravity with any activity. Also, so many of the nerves that innervate the pelvis, and the muscles originate from the spine. So it's really important that We look at how everything is moving in terms of what we call segmental motion, and correct those so that then the nerves that are transmitting down to the pelvis and to the legs and even to the feet are moving optimally, because it's all about optimizing movement. No matter what the dysfunction is, we want to optimize what your strength is, what your mobility is, what your flexibility is, and it all fits together. It all connects. That's a very holistic model that I am very connected to.
Okay, so I want to get to our first question here. This came in from a listener named Rachel. So we talked a lot about leaking in that intro. She says, I suffer from a leaky bladder, and my bottom has just never felt right since giving birth. I now have issues with my bladder and butt. Is this something a pelvic floor PT can help with? I love to run, but have stopped because I leak every time I run. I tried a group exercise class and left early because I leaked so badly. This leads to my self-confidence not being so great, as well as doubts of having another baby. How can I get help with this issue? So what I would love for you to do, Debra, is to use your props and show us how things interconnect, so that would lead to when you have a baby leading to a leaky bladder, and how the leaky bladder can be mended.
Okay, so the first thing I would say is, after you have a baby, there's so many soft tissue healing effects that are occurring, and so I know when women go for that checkup and they think it's the green light to have sex, it's really about what are the soft tissues that have healed, and that includes your uterus and your which is sitting over your bladder, and the vaginal tissue itself, and you've had 40, the average woman has had 40 weeks of everything changing in her body, from the circulatory system to the urinary system to the, as Holly described in the podcast, the cardiac system. Everything everything has changed so much, and you're really recovering from those changes in the early postpartum time. So if you don't respect those soft tissue restrictions, and if you don't respect that you need to get back to a much stronger state, because everything has been stretched out and weakened in a way. So if you don't take the time to really do some specific core strengthening, and then you start doing something so super active like running or going to boot camp, or your body just can't take that kind of pounding or loading, and then your pelvic floor muscles are probably in a weakened state too, and possibly there's a little bit of a prolapse from the bladder. So the leakage occurs because
what is prolapse from the bladder?
So the pelvic organs, the uterus, the rectum, and the bladder can actually weaken, the tissues weaken, and they drop down towards the pelvic floor. So even some young women might feel a bulge, or one patient described it as a cotton ball feeling in her vagina, because she was trying to do too much too soon, and her particular body was just not ready to go to those limits. She needed to really step back and do some very specific strengthening of her pelvic floor and of her abdominal wall and of her glutes and of her hips, in order to get to the place where you can go running and then not expect to leak. So for the person who is asking this question, and she said that she has a leaky bladder and some discomfort in the bottom of her butt, I don't know exactly what that means. It could be a couple different things. I mean, she might have hemorrhoids, she might have some prolapse, or she might actually have pain in her hip joints or weakness in her hip muscles that she's not recognizing as a hip dysfunction. So it feels like just pelvic and bottom pain.
So what can someone like this do?
Well, the most important thing is that it's very hard to figure out what it is exactly that your deficits are in terms of your musculoskeletal function. So it would really, it would be in her best interest to go to a physical therapist and to see what, to get evaluated and see if her spine is moving well, see if she does have weakness in her hips. And a pelvic floor physical therapist really puts this together in a very unique way, because we really incorporate orthopedic, musculoskeletal evaluation and treatment with all of these bladder and pelvic floor issues. So she really needs to find out what the true problem is in order to get stronger. And that might very well be her pelvic floor muscles more than anything else.
So do you recommend that people, before they start really exercising, strengthen themselves back up?
They really do. And it's really, after you have a baby, you need to, as I said, you need to really focus on the pelvic floor and on the deep abdominal muscles and on some of the hip muscles in a really slow, methodical way in order to build up good strength, because that will give you really the groundwork for doing whatever else you want to do. And it might be walking, or be on the elliptical, or strength training. But I really encourage postpartum women to take a step back, because in my practice I've seen women just shoot out of the gate too quick, and then they have leakage, they have pelvic floor weakness, and then you really have to take several steps back to get to the place where you have a good core and to go forward from that.
Okay, let's go to our next question. This is a pretty common one. This woman says, I'm currently 4.5 months postpartum. I had an episiotomy and grade 2 tears. Things weren't stitched up correctly, so 12 weeks post-delivery, I ended up with large amounts of granular and scar tissue and perineoplasty. The shape of my vagina is different. That's something we heard in the last episode. I think that's really common, people feeling like the shape of their vagina is different after having a baby. The perineum is significantly shorter. The bottom of my vagina feels tighter. I tried sex for the first time last week, and it went better than expected but caused pain. I'm certain I will never be the same. I'm also having a hard time touching myself or allowing my partner to touch me with his hands. The scar tissue bothers me, and it seems like I just need to stretch things back out. But she also adds, I live in a rural area that does not have any pelvic floor physical therapy. What can I do at home to help improve myself?
So there's quite a bit that this woman could do at home, and I think the first thing is really learning about your own body and where you have pain, and I think a great resource for that is Kathy Wallace's book, which is Reviving Your Sex Life After Childbirth, because she has great pictures.
Show us the cover, Deborah.
Yeah, so this is the cover. So Reviving Your Sex Life After Childbirth. So Kathy was also my mentor, as well as Holly Herman. I started studying with them 11 years ago. And it's a great little book, and she can order it on Amazon. And the beauty of this book is that Kathy really includes these great drawings that really help someone figure out exactly where it is that they're having pain. And again, I think part of recovering is really being able to empower yourself and identify where you have pain. So there's techniques for doing your own soft tissue work. I also am a big fan of something called the TheraWand, and also vaginal dilators.
Wait, what's the TheraWand?
The TheraWand is also known as the crystal wand, and this is a great tool for someone to mobilize or stretch their internal pelvic floor. And I can show you with this other little plastic model that I have. So this is a little plastic model that I got last year in Chicago at a conference. And the nice thing about the TheraWand is you see it has this hook, right? Or I don't want to, hook sounds scary, but it has a curve. So you're able to insert it into the vagina, and you can turn it so that you're really able to get to the deeper parts of the pelvic floor, including the pelvic wall, which is the obturator muscle, which is kind of the inside bowl of the pelvic floor, because a lot of adhesions and discomfort occur there. So it comes with instructions. She can also have a phone conference with a pelvic floor therapist. A lot of us will do that type of consultation. But she can really make a difference in using this at home and being able to manipulate her own tissues. And then I find that doing that and then using graded vaginal dilators. Now this is a teeny one. This is like the size of a extra small tampon, but they get much larger. And that way you can do your mobilization. You can practice penetration. So you can place this in and practice just holding it in the vagina or doing some stretching. And that really gives someone who's in pain a very concrete plan and techniques and strategies to work on their own pelvic floor pain and dysfunction.
Can you talk a little bit about what muscles are in there? I think we often think of it as just like a hole, you know. Like, what's going on in there? You were talking about massaging out the muscles. Can you do
okay, so well, I'm going to use both. So, you know, there are 3 layers of pelvic floor muscle, and so I'm going to use the most superficial muscles are the ones on the outside that, you know, so when someone is looking at their own body, and that's something that I also I think it's very important for women to get a mirror, go to CVS and get a nice round mirror that has 2 different magnifications, and you can really hold it and see what's going on. But the outer part this is the part that gets injured with the perineal lacerations and the tearing. So after you have a baby, this part between the vagina, the vaginal opening or the introitus, and the anal opening, this is the perineal body. So this is a central tendon. This is where you will have tearing as well as inside, and this is where if someone's having an episiotomy, they will cut this area. So most women who have injuries to the pelvic floor are most probably experienced or, you know, familiar with these more external types of the muscles here. But, you know, some of the injuries can also go, if you have a 3rd or 4th degree perineal tear, it can actually go into the muscles that surround the ring of the anus as well as into the rectal tissue itself. So those are the more superficial ones. Even the ones that are on your labia, these muscles, they're little muscles and they close the labia like this. So, you know, sometimes I even teach women to try to feel that, try to see what that feels like, because that's a really important part of just getting in touch with the more superficial. And then there's deeper muscles. The main muscle group in the pelvic floor, let me try this way, is the levator ani. So if I turn the pelvis like this, these are the muscles that are like the sling, and they really help to hold up your pelvic organs. You really want these muscles strong, and these muscles also these deeper muscles get injured in childbirth because as the baby's coming down the birth canal, they can really incur a big stretch, and then there's and I'll show you from here as well. So, and there's a major nerve here called the pudendal nerve. So the pudendal nerve innervates these muscles, and they're really, you know, again, they're like a sling, but they're also like a floor. So when you contract your muscles, they lift up. And then the other main group that I was talking about are the obturator internus, and I like to describe it as and I use my hands often, as the wall of the pelvic floor, because these are the muscles that contract like this and help to give your bladder support. So there's other muscles that also create a pulling in sensation. So overall, when I am evaluating someone and I'm teaching them to feel it themselves, what we do as pelvic floor therapists is we explain that it should feel, a muscle contraction should feel like a lift, a squeeze and a pulling in, or as Holly and Kathy often said, it's like if you had your pinky in the baby's mouth and there was a big pull, they're sucking on it. It's like suction. That's what really good pelvic floor muscle strength is. But after childbirth, it's rarely like that. On the other hand, I just want to say you can also have pelvic floor muscle spasm after childbirth because of tension from the delivery or from compensation from someplace else. So there's quite a few muscles, but they all function together, and that's really the goal, is that you're trying to restore all of the pelvic floor muscle function, and it affects both the bladder, the bowel, and the sexual dysfunction.
Debra, are Kegels always good?
No. So as I said, and that's a great question, because Kegels are not always good. I mean, they're good if, Kegel was Dr. Arnold Kegel, and he was the first physician in the late 40s who realized that if he used his hands to examine a woman, he could feel how strong she was, and it gave her some feedback about what the strength of her pelvic floor muscles. That being said, if your pelvic floor muscles are in spasm, you don't want to do Kegels. First, you need to be able to decrease the spasm, and that's where the TheraWand or crystal wand comes in, because if you don't have a physical therapist who can help you with, then you can really feel that spasm or tightness when you're using the wand, and you can really help to decrease that, lengthen the muscle, and then see how the muscle reacts and if you need to be doing strengthening or Kegeling.
Great. So I want to ask another question. This came in from Chris. She says, I've been married for 45 years. So this is a mom further along. Intercourse was never that comfortable, but about 6 years ago, husband said we didn't have to do it if it was so painful due to dryness mainly. She tried all of the obvious stuff, estrogen ring, lubricants. Up until that time, her gynecologist said she'd tried them all and agreed that it was like a desert down there. Would physical therapy help? This is a great question. I don't know the answer. Yeah. Can it help with lubrication?
Yes. Well, it can absolutely help with lubrication. But first, I want to quote a friend of mine who's a great midwife who says, postpartum is forever. So it doesn't matter if you're a year or 5 years or 40 years postpartum, your body has changed. And, as long as you're alive and kicking and everything's moving, you can still change, make really great changes. But if you've gone through menopause or if you're older, you're definitely going to have tissues that are deprived of estrogen and are going to need more lubrication. So there are a lot of great non-hormonal and steroidal lubrications out there, and even if you go to CVS, they're now making them without alcohol, without parabens. But once you if you stop using your pelvic floor, you lose it as well. So doing pelvic floor physical therapy, having sex, doing, really paying attention to what's going on in terms of your pelvic floor function can certainly increase the lubrication and the overall function. She can make a huge difference. I mean, I've had patients throughout their 60s, 70s, and even 80s who can change their pelvic floor function. So there's definitely hope for her. She just needs to use the right product. It would help if she found a pelvic floor physical therapist and a willing husband.
What else? Are there any other home remedies for that kind of thing?
There's home remedies for lubrication. I mean, there are some women who really like using coconut oil. You can use coconut oil, olive oil, aloe vera. As I said, there are non-steroidal creams like Neogen. But I think just working on doing some pelvic floor strengthening if she's weak can also really make a difference, because it can increase her ability to have an orgasm, and she might just really might find that she might also want to add some other things that affect her sexual life. So in terms of, there might be erotica that she might want to read, or there are different ways. It's so multifactorial, especially when you feel like there is no hope. So I think the psychological and the physiological really meet up, and it really needs to be looked at holistically. But she can definitely make a change.
Great. So here's another one where I have a question about how things connect. I understand that some women who have C-sections can wind up feeling pain in their pelvic floor and vaginal pain during sex. Can you show us, take out your model again, and show us how those two things connect?
Well, my model's not going to be great, but I can explain. So, okay. So when a woman has a C-section, they're cutting through skin and fat and connective tissue and muscle, and then something called the peritoneum, which is the lining of the abdominal wall. So all these other incisions that they start with, and I'm using the model. So here's the top of the pubic bone, and because they start with a bikini cut. So all of these cuts are usually horizontal. Then when they go in and cut the peritoneum, and if you can imagine, it goes around like this, because it's the lining of the abdominal wall. Now the cut is longitudinal, and when they make that cut, they will often put a device or some kind of instrument that's pulling down on the peritoneum and on the tissues as they're going into making the cut into the uterus and getting the baby out. Now they're also they're cutting some peritoneum that might be connecting the bladder to the uterus. So so there's now this is just during the surgery itself. There's now a force that's being pulled down, and I think what happens is that tissues are being dragged down. There's what we call adverse tension on these tissues, and then as I said, there's so many nerves in the pelvic, so I think that the nerves can also get compressed. So that's one contribution of how a C-section can affect pelvic floor dysfunction. But then the C-section scar itself, as I described, is going through lots of layers, and those layers are affecting now in this downward direction and towards the pelvic floor. So there are adhesions that you want your scar to heal, but you don't want adhesions so much that the tissues can't move anymore, and you want to encourage mobility of the fascia, which is the connective tissue, the muscles, and of the organs themselves. So if there's so much adhesion that maybe now the bladder is not moving properly in the pelvis, that can also cause a drag on these tissues, and then there's resulting pain in the vagina.
Here's another one. I know a lot of moms who get a separation in their pubis. That's the where the pelvis comes together in the front.
Right, so that's,
show us this is pubis.
So this is the pubic symphysis. This is the front of the pelvic girdle. So ideally, this is a disc or a gel here that softens during pregnancy, because it allows the baby's head to engage deeper into the birthing canal. So yes, some women get a separation, or some women even get a dislocation. But what I find is that there's also, because there is so many muscles that connect on the pelvis itself, sometimes this separation or dysfunction is really because of the forces from the muscles, the hip muscles, because your inner thigh muscles, which are adductors, they originate here, so they could be pulling on these on the pelvis, and then there's maybe an imbalance in the muscles of the hips. I just had a new patient who presented with a lot of pain here, and she gave birth only around 3.5 weeks ago, but she told me she was standing during most of her laboring. She didn't want to sit down. She was too uncomfortable. So that she was standing for basically 12 hours. So standing and swaying and rocking and going into labor put a lot of strain into this joint. So it can happen, it can happen during the pregnancy, it can happen during the labor, it can happen during the delivery. The most important thing is to figure out what are the muscles and the joints that need to be rehabilitated, and it can be pain-free after that. It doesn't have to be a long-term persistent dysfunction.
That's interesting. There's a lot of talk about what position to be in labor and delivery,
right.
And we don't really learn during the lectures on like positions for labor and delivery what impact that can have after. And that's not to say that you shouldn't choose those positions, but maybe we should be more aware of the impact they can have.
Well, I just want to say something about that, because I think what can happen is that you can have the you can have a birth plan. You can think that you maybe want to labor like in squatting, but then if you're at a hospital, you might be subject to the rules of the hospital. So I have patients who have really suffered some pretty bad hip injuries because they were told that the hospital policy was that they had to have their hips, way flexed at back, like practically by their ears, and that position really doesn't work for a lot of women. But the problem is women they're not evaluated beforehand to know if they have a pre-existing lower back or hip problem. So those things can really make it worse. But physical therapists can really help if you have a pre-existing condition, can really make suggestions to your birth provider about what would be the best position for you to deliver in.
We just got a question in now from a listener who is afraid to even see a pelvic floor physical therapist. What do you have to say to someone like that?
Well, first of all, anyone who is a pelvic floor physical therapist is so devoted to helping someone like her, because it's a very intimate thing that you're coming to see someone for this. And the women that I know who do pelvic floor physical therapy are all an amazing bunch of caregivers, and they are really so concerned about helping women and making them feel comfortable, and it really changing their life and their function and their, as I said, their quality of life. That I think everyone has apprehension, and as I said before, there's also shame and fear. And I think that if you call a physical therapist and have maybe a phone conversation with them first, they can really help you feel more comfortable, and then maybe it wouldn't be such a big deal.
I just got an update on that question. Her fear is specifically about that the person would tell them there's nothing that can be done, and that's interesting because that's also Sadie from our last episode. That's where we left it with her. She was so comfortable talking about her pelvic floor issues, and yet was too afraid to see someone because she's afraid she'll be told, "I'm sorry, you're going to have to live with this forever."
Right. And I think, as I said in the beginning, I think that is just the wrong message. And I think that, as I said, we really have the intent to cure, and things can get so much better. I mean, there's no reason to think that, unless it's really a medical problem that a therapist feels is totally out of their realm. If it's a musculoskeletal problem, there's probably a musculoskeletal solution. So I think there's so much, a pelvic floor therapist would give them tremendous comfort and help them to realize that there's quite a bit that they can do.
Um, so I know that a lot of people after their childbirth injuries feel pain. We talked about the back, but you
Mhm.
can also feel pain in your leg. I've heard some people feel pain in their foot, in their neck. Like, how does the pelvis have such a far reach? Can you show us some more connections there?
Well, you know, there's a far reach, but there's also, I mean, you have to think in terms of the nervous system. So besides the pelvic floor muscles, I mean, there are connections both through the nervous system, through the viscera themselves, through the, and I mean the organs, all of the abdominal and pelvic organs that connect to your spine. So, so someone, you know, and it could also be due to the position that they were in during the birthing process, and then just the toll of taking care of a new baby after you've been through such a, you know, 40 weeks of changes in your body. But, you know, if the pelvis is connected to the sacral and the lumbar nerves, so the muscles of the pelvis are innervated, which means that the nerves from the lower lumbar, they innervate these muscles, but they also innervate the foot muscles. And so your L5 vertebra, which is, or your nerve root, it innervates your glute muscles, and it also innervates the bottom of your foot. So if you're having a problem in your pelvis or in your spine, and that nerve is not getting the good conduction, it is optimal, then you might feel it as a foot injury as well, because the muscles might be atrophying or the nerves are being congested through the line through the leg. So that's one example. You know, the pelvis really depends, the pelvic floor muscles really depend on optimal function of your diaphragm, your breathing diaphragm. Your breathing diaphragm is way up at the bottom of your rib cage, so that's in the thoracic spine. The diaphragm is connected through the nervous system into your shoulder. So there's so many nerve and visceral and muscle connections that it makes sense that you might feel something in an area that's not just focused on the pelvic floor.
I think there's also a lot of compensating for pain, right? When you feel pain in your
Tremendous.
pelvis and you need to sit in a certain way.
That's right. And also, if you've had a hip injury from your childbirth, or you know, you might really be compensating through the opposite leg, through the pelvis, through the foot. So that's what I'm talking about. There's tremendous compensations. There's so many functional things that you do when you have a baby that are requiring upper body strength, and yet the weight of your breasts after childbirth, and if you're nursing or sitting and feeding, it all can really impact what's happening through your spine, and that's affecting all the way down to your pelvis. So it's really, you really want to look holistically, and you want to get better holistically. You want the whole body involved in your rehab. So that's why when my patients, we work on the pelvic floor, but we, you know, anything else that we need to do, if we're working on the spine, if we're working on strengthening the core, if we're working on, you know, balance, it's just all part of looking at the whole body and recovering from that.
You know, it's interesting to me when I was talking to Holly Herman, this didn't wind up in the story. She told me that the way that they train physical therapists at the Herman and Wallace Institute is to that they actually get worked on.
That's right. That's
Right.
how we learn, which has been awesome. And it, you know, it wasn't that easy.
So tell me about that. Like it sounded to me like a room full of women
That's
being,
right.
and was it all women? I mean, like it's a room full of people being worked on all at the same time.
That's right. So, you know, I think there are more men now who are taking some of the classes, but back when I took my first class, you know, it was something I really wanted to do, but I also had hesitation. It just seemed, it was just difficult for me personally. But as soon as you do it, I mean, they create a camaraderie, and it just becomes effortless, and it becomes, you know, you get to know people very well, and you get to know your body, and it's such a great way to learn. And I tell patients that, you know, I tell them that everything that I'm doing with the manual therapy, with my evaluation, with the treatment, I've had it done myself, and that's how I've learned. And, you know, I think that there's a real comfort in that. And I once told that to a urogynecologist who was just stunned by that, because he couldn't believe that you know, I had been through that myself, or that's the way we learn. And I think that's what really, you know, that's what makes our work so personable too, is that we know what the patient is feeling, as opposed to, you know, using a model and not really connecting with what's happening. So Holly and Kathy really set an amazing tone for training therapists, and that's why we're a very strong community of pelvic floor therapists. Our hashtag is Pelvic Mafia, and we have, you know, we have a great time together when we get together at our conferences, because we're all so dedicated and so in love with what we do, because we really change people's lives.
And for people who don't know what we're talking about, Holly Herman was on the last show, and she and Kathy Wallace, her colleague, were some of the pioneers in this country of pelvic floor physical therapy.
Right.
Was there anything we didn't cover that you wanted to talk about?
No, but, you know, I just want to really thank you, Hillary, because on behalf of myself and my incredible, smart, and passionate colleagues who I have been talking about, to bring this topic to such a national audience, I think is really awesome. And clearly the response says it all. And you know, I think that we, as therapists, we still struggle to get the information out and to have the medical community acknowledge what we do, but we also really acknowledge the struggle that our patients have, because typically they see so many providers before they come to see us. I mean, and you know, as you have said yourself, it took you a couple of years. So it shouldn't be like that. It should be, there shouldn't be the stigma and the shame of having these issues. It should just be the same as if you sprained your elbow or if you had a knee injury. It shouldn't be such a big deal. We should really advocate for patients being able to access this information and to get the treatment they deserve. So I thank you so much for the opportunity.
Thank you for coming on. And actually, I'm going to throw one more question at you, because someone slipped one in at the very last minute. We have a few minutes left. What can I do to make sitting down comfortable again, is the question.
Okay. Well, you know, I don't know the reason why she can't sit down. There could be several reasons.
One has hemorrhoid. I'm not getting this in. Yeah.
She does have hemorrhoids?
Yeah, late breaking news. This woman has a hemorrhoid.
Well, you know, hemorrhoids, if it's just hemorrhoids, then sit baths and actually focusing on the rectal part of the pelvic floor, doing Kegels can help, because it might be that there's a weakness or a laxity in the anal canal itself. So doing pelvic floor strengthening with a focus on the rectal area can really make a difference. She could also use, you know, the cushions or a rolled up towel, but you know, you can also go to a colorectal surgeon and they can do like a quick banding technique, which if that's really an issue. But as far as what she can do herself, sometimes just working on your own pelvic floor, even rectally, can make all the difference.
I want to leave people with, you did a blog post for us called Starter Kit Home Remedies for Getting Your Sex Life Back. And there was all different, you like had your top picks of products and books for people to get started at home. Although, of course, we recommend that you see a professional if you're having health issues.
Yes.
But these are just some things to get you started. And there was something in there that you wanted to talk about a little bit more and show us how it worked. So do you want to go ahead with that?
Okay. So, well, this you're talking about this item?
I am talking about that item.
Okay. Well, this is a little different. I have the other one that I put on the blog, but this is a product by In Control Medical. It's medical grade silicone, and what's really great about this, especially, I'm going to talk a little bit about women who have pelvic floor weakness, because you wouldn't use this for someone who is in pain right now, but for someone who has pelvic floor weakness, this is amazing because it delivers electric stimulation to the pelvic floor muscles. So
how would you even know if you have pelvic floor weakness?
Well, if you have bladder and bowel leakage,
got it.
There's a pretty good chance you do. The most common way that you can evaluate yourself is when you're in the bathroom and you're urinating. If you cannot stop your flow of urine in midstream, that's a pretty good sign that those muscles are not kicking in. If you have sex and you really don't feel anything, especially with penetration, because you just can't get those muscles to contract, that's a pretty good sign. So some women need so much help after having a baby because their pelvic floor muscles are just completely shut down or inhibited because there's been a nerve injury. So this one is not a vibrator. There is one that on the blog post that I put's a vibrator, but this is electric stimulation, and it's customized for each one because it has a pump and it expands to the opening size of their vagina.
Wow.
So it really helps someone who is lacking feeling, because then it expands enough that the vaginal walls can really come in contact with the probe, and then after they do this, when they're doing the stimulation, they should really feel their muscles pulling the probe in, and it's really activating those muscles. So there's one product that I put on the blog that is a combination of a electric stim and it's a vibrator, but you wouldn't use the vibrator of that size for someone who's in pain. I put a smaller vibrator on the blog, and I also talked about using a vibrator rectally, because if you're having pain vaginally but you feel like you want to start engaging in sex, why not try it rectally or anally. And then the other thing that I wanted to talk about is the book. So can I talk about this book, which I think is hilarious? And I actually got this book at Urban Outfitters. They have some really great.
What's it called, Deborah? It's
called Position of the Day: Sex Every Day in Every Way. So it's 365 pages of line drawings of different positions, and it's appropriate for both. There's suggestions for both male and female positions, or female, so same sex. But I have to say, number 91 is called The Physical Therapist. So I especially love that. But these are things that you can do with your partner, that you can look through with your partner. And especially if you're having pain, you might say, oh, that position might help me get some of the tension off of the right side. And so it can actually give you ideas for how you can get back to doing it, which is the whole focus of your first podcast, right? And to have some fun at the same time, because it's all about the fun. So it's all about not having pain, having fun, and getting back to your sexual self in whatever way that feels comfortable and best for you.
Well, you can read the rest of Deborah's recommendations at our website, longestshortesttime.com. That's in the starter kit blog post. Debra Goldman, thank you so much for joining us.
It's been my pleasure. Thank you so much.
So we've got 2 more episodes left of the Sex and Parenthood series. The best way to get those are to subscribe to our podcast in iTunes or in your favorite podcatcher. You can also find all of our episodes at our website. And thank you to everybody who sent in questions. Thank you to my lovely producer, Joanna Solotov, who is hiding behind that WNYC logo. And she's just been wonderful putting this whole thing together and getting all of your questions to us at the last minute. Especially, she told me just now we had a lot of last-minute hemorrhoid questions, so thank you for answering that one. And of course, thank you to WNYC for co-producing this. Remember that we take stories from our audience for our podcast, and we have expanded our age range from early parenthood to all of parenthood. So you can talk about being a parent, you can talk about being the child of a parent, you can recommend your own child for the podcast. So if you have a story of a surprising struggle in parenthood or in family, please send it to us at longestshortesttime.com. On the homepage, you can submit your story. Also, our shows come out every other Wednesday at 3 o'clock in the morning, and if you want to get it 6 hours earlier, so 9 o'clock Eastern the night before, you can sign up for our newsletter. That's on our website, and you just type in your email address, and I'll send you a secret link to the show. So thanks, everyone, for watching. Thank you, Debra, and we hope you enjoy the rest of the series. Bye.